Diabetes Connections is brought to you by inhaled insulin, glucose management in the moment, Omnipod 5, the only tubeless pump that integrates with Dexcom G6, and by Dexcom G7, effortless diabetes management that fits into your lifestyle.
This is Diabetes Connections with Stacey Sims.
This week, Medicare expands coverage for CGM use among people with type 2, in part because of studies by companies like Dexcom. We'll talk about those findings and learn more about the U.S. release and updates to the G7.
One of the things if G7 users will notice is we've started doing quite a few updates to the G7 app. So it's kind of playing through what I told you before, which is G7 is going to have a lot more frequent updates than our previous generations based on the way we've designed it.
That's Dexcom Chief Operating Officer Jake Leach. We get an update on those updates he mentioned, talk about CGM for people with type 2 and gestational diabetes, pump integration for the G7, smoothing and what that means, and a lot more. This podcast is not intended as medical advice. If you have those kinds of questions, please contact your healthcare provider. Welcome to another week of the show. I am always so glad to have you here. You know we aim to educate and inspire about diabetes with a focus on people who use insulin. I'm your host, Stacey Sims. And if you're a longtime listener, you know that little introduction I do has changed. When I started the show in 2015, I used to say with a focus on people with type 1. But, since then, a lot has changed. The technology has certainly gotten better, and there are more options for people with type 2, especially people with type 2 and other types of diabetes who use insulin. And that's why I changed it. And I really believe that. I'm thrilled to have more people with different types of diabetes listening to this show. And one of the biggest changes really has come recently with this change in Medicare coverage. We're going to talk about it a lot more with Jake Leach. But the bottom line is, if you have Medicare coverage, and you use insulin, and not just, multiple daily injection or pump type use of insulin, but basal insulin, your CGM is now covered. And you may also have CGM coverage through Medicare if you don't use insulin. So it's really important that you check with your doctor. Even if it's your general practitioner, definitely ask. Of course, I am asking Jake Leach a whole bunch of other questions pertinent to folks with type 1 diabetes. I always love asking these folks your questions. Some of these came from the Facebook group, Diabetes Connections, the group. I'll put a link in the show notes if you'd like to join us there. And you can always email me your questions. I'll save it for a future episode, Stacey@diabetes-connections.com. I do mention a milestone for Benny. I got a little sentimental toward the end of this interview because it has been 5 years since the G6 was approved. And that really made a big change for him and how our family reacted around diabetes. So I will talk about that, but I'll do that after the interview. And my usual quick note, Dexcom is a sponsor of this podcast, but they do not tell me what to ask or what to talk about during the interviews. If you are new, I try very hard to disclose all of that. I'm happy to answer any questions you may have. Okay, first, Diabetes Connections is brought to you by Afrezza. Quick biology fact, did you know your lungs have the surface area of a tennis court? That's interesting, but why is it important? Well, since Afrezza is a powder you inhale, the insulin is delivered through the large surface area of the lungs, which allows for ultra-rapid absorption. The insulin passes through your lungs into your blood in less than 1 minute. Your blood sugar may start to lower in about 12 minutes. That's glucose management in the moment. Find out more and see if Afrezza is right for you. Go to diabetes-connections.com and click on the Afrezza logo. Afrezza can cause serious side effects, including sudden lung problems and low potassium, and is not for patients with chronic lung disease such as asthma or COPD or for patients allergic to insulin. Tell your doctor if you ever smoked, have ever had kidney or liver problems, a history of lung cancer, or if you are pregnant or breastfeeding. Most common side effects are low blood sugar, cough, and sore throat. Severe low blood sugar can be fatal. Do not replace long-acting insulin with Afrezza. Afrezza is not for use to treat diabetic ketoacidosis. Please see full prescribing information, including boxed warning, medication guide, and instructions for use on afrezza.com/safety. Jake Leach, thank you so much for joining me once again. Always appreciate your updates. Thanks for spending some time with us.
Oh, it's great to be here, Stacey. Love it.
Yeah, we got a lot to talk about, but I want to start with the recent indication and change from Medicare to allow more people with type 2 diabetes to access continuous glucose monitoring. Can you talk a little bit about this? Because obviously this affects Dexcom, but you had a lot of studies and things about this as well.
Yeah, we did. So, it's really exciting for the Medicare community and the diabetes community in general, but it's the largest single decision for access ever for CGM. So meaning that single decision for Medicare to cover it for this new population. It's the largest population that has gotten access to CGM at one time. So we estimate it's about 1.5 million people in the United States now who didn't have access previously to CGM now have it covered by Medicare. The population that is covered here is people on basal insulin, so taking basal insulin, and also anyone who has hypoglycemic events, right? Whether kind of treated by a physician or even by themselves, if they're having problematic hypoglycemia, that also makes perfect sense. The CGM is perfect for helping detect and manage hypoglycemia as well. So it's a really exciting group of folks who actually just got finalized a couple of weeks ago, where now the coverage is there. People can begin accessing CGM through Medicare. So background on it was there was a significant number of studies, as you mentioned, that were kind of the evidence to prove. So no payer, whether it's Medicare or a private insurance, is going to cover a product without ensuring that it has a clinical outcome. And so we ran a study called Mobile, which was about 175 people with type 2 diabetes that were taking basal insulin. So one shot a day, basically, of insulin. And in that, we basically 2/3 of them used CGM and 1/3 of them used finger sticks for a period of about 8 months. And we tracked them the whole time. And what we saw was in the group using CGM, significant reduction in their A1C over that period of time. So this was all done with G6 product. We saw a great outcome there. We also saw really significant time and range improvements in the CGM group. That's really the outcome that we believe will not only improve people's lives and they're living with diabetes, but also help with the cost of care, right? As you improve those outcomes, you're going to reduce the cost of those patients per year.
As you said, you have to show these things in studies before anybody will pay for them, regardless of what the insurer is. I'm curious what you think happened there. Somebody taking basal insulin isn't doing insulin adjustments during the day. They're not, right? They're not giving themselves a little bit more for this. They're not covering a meal more accurately. So what was it about the continuous glucose monitoring that changed the outcome?
It's a great question, Stacey. So basically the consistent feedback you get from CGM, right? Real-time CGM gives you those, as you know, gives you those readings every 5 minutes throughout the day. And I think what it does really is it gives you insight into what's really going on with glycemic variability, diet choices, and exercise. All of those things factor into glucose, as well as stress and other things. And CGM is such an amazing tool for learning about yourself as an individual and how your body processes food, how it reacts to medications. Right. One of the things that we've seen is that when you're using CGM and you're taking a medication for type 2 diabetes, you can see the effectiveness of the therapy immediately. It's not like you have to wait the 3 or 6 months to go in and get an A1C check to say whether you're doing better or not. It immediately shows you that your glucose is in better control. And so I think all of those things combined are why CGM makes the impact it does, even on people who aren't taking mealtime insulin, like you mentioned.
175 people. It's not a big study. Do you think it was effective because there's so much data about CGM already, people with diabetes? Did it just build on other previous studies?
Yeah, I think, the main thing was, because one of the things about clinical studies is when you have a big impact, you from a statistical perspective, you don't have to have as many patients. So we felt very comfortable that with that size and knowing how much CGM, the impact it'll have on the A1C, we kind of said that's about the right size of the study because we already kind of knew what we were going to see coming into that because we know CGM improves outcomes. So there's also, there's a lot of data out there, right? A lot of different studies have been run. This was the one that was a randomized control. Mobile was a randomized control trial in the primary care setting, which is unique too, right? It was not run by endocrinologists, it was primary care. It was also run in a very diverse group of individuals, both socioeconomic as well as racially diverse. And we did that on purpose to basically disprove some of the thoughts that were out there around, only certain people can benefit from CGM. And so we basically kind of dispelled that with the study, as well as showing the overall improvement in time and range and A1C. So it was a pretty powerful study, and it was the main piece of evidence, although there was a lot of other evidence used as well for that Medicare decision.
I'd love to talk more in depth sometime about general practitioners versus endocrinologists, because people with type 2 mostly.
Yeah.
I mean, my husband, I don't think has ever seen an endocrinologist. And he's got a great GP, but at the same time, they're not specialized. Are you doing tons of education for those doctors?
It's a big part of it. It's awareness that the technology exists, right?
Yeah.
Awareness that it's out there, something better than finger sticks. And then also awareness of the impact clinically it has on their patients. And so bringing that awareness is a super important part of our strategy as we move forward. A number of years ago, we expanded our sales force primarily to be able to call on those primary care physicians and get in there and talk about CGM and talk about the benefits and talk about how it can improve clinical outcomes. So it is an ongoing process. I mean, awareness for CGM is much better now than it was even a year or two ago. But there's still more to come here. There's still plenty of people out there who don't have coverage for CGM that could benefit, that have diabetes. If we think of beyond the basal insulin using populations. And so that's another, clearly we're focused on bringing more access for CGM.
Before I move on from the type 2 crowd, I do have to ask, you said, you're exploring different ways to get more coverage for CGM just for having diabetes, not necessarily using insulin. Do you think that would include using some of the other injectables, the brand names that we've all heard, like Wegovy, Mounjaro, all that stuff? Ozempic.
100%. Yeah, we've actually seen smaller studies where we're seeing very similar A1C improvements with people with type 2 diabetes on orals and on those injectables. And I think CGM is a great companion for any of those therapies because, as I kind of mentioned, it shows an individual who's taking, it's either injectable or an oral, and it shows them the outcome that they're getting by taking the drug. I think that's a really powerful component of diabetes therapy, is to say, yeah, I'm doing better. I'm able to control my glucose. I feel better. That's a big part of what CGM unlocks for people.
Great. All right. Let's roll on to G7. The rollout happened several weeks ago, but still finding its way through insurance, that sort of thing. Any updates? I know that when a new product comes out, people are always worried, is my insurance going to cover it? How's that going? Any hiccups to report?
No, things are moving faster than we expected on that front, right? We put our bridge program in place, which was basically a program that would cover, it was a very approachable cash pay price for G7 while we were kind of getting coverage for both the private as well as the government insurance. But, we've got Medicare coverage for G7 now. The vast majority of the commercial contracts are done. So it's coming very quickly. We'll keep the bridge program in place for a little bit longer, but G7 coverage is going great. There's always, though, we've had plenty of customers that try to get it, and something wasn't quite there yet. But that, every day that keeps getting better and better. And so the launch is going great. We've got a lot of new customers, so new to Dexcom. About half the people on G7, kind of in the US and also internationally, are new to Dexcom, and then the other half are folks that have been upgrading from G6 to G7. We still have a large base of people using AID systems that are on G6. And so as soon as those systems are compatible with G7, they'll be upgrading. So yeah, it's going great. And we've been continually increasing our capacity. So the launch of G7 is unconstrained in all the markets that exist, meaning, there's no phasing of who gets the product. If you want it, you can get it. That was a very important part of our readiness for launch, was to have the capacity. And we're going to continue to build more and more manufacturing capacity throughout this year and next year.
Great. You mentioned the AID systems, Tandem and Omnipod. Those companies are responsible for that. You have told me that before. Can you give us any update on how it's going? Right back to Jake answering my question. But first, Diabetes Connections is brought to you by Omnipod. And I love it when I don't have to deal with a faraway mail order system, when I can just pick up diabetes supplies from my pharmacy. I did it today, and it's a breeze. Omnipod is the only tubeless, full-feature insulin pump available through the pharmacy. It makes it simple to pick up pods and insulin in the same place, and you avoid high startup costs from traditional tubed insulin pumps. You simply pay as you pod. Remember, pharmacy means no commitment, and pharmacy means you can switch now, even if your tubed pump is under warranty. Learn more. Go to diabetes-connections.com and click on the Omnipod logo. For full safety, risk information, and free trial terms and conditions, also visit omnipod.com/diabetesconnections. Now back to Jake talking about Dexcom G7 integration with pump systems.
Things are progressing to plan. I think those, ultimately the actual introduction timing is up to those groups. But, I've seen plenty of data of the integrations working and validation testing and all that stuff that's been going on for quite a while now. So feeling really comfortable that they're both getting close. And when they do launch, it'll be an exciting day for those users to be able to upgrade to G7.
I got a question from a listener, and I might be wrong. They said that they both Omnipod and Tandem would need to submit their interoperability together to the FDA each for a separate approval. Is that true? I thought they just had to make sure it worked.
Yeah, I think from a regulatory perspective, they may need to do that. But my understanding is that it's more around proving validation that the devices work and that G7 is compatible with their device. So, but that's probably best the question that they answer. But my understanding is that it didn't require filing.
I'll run it by each of them just to make sure. Okay, a couple of quick questions from my listeners about the G7. Can you talk a little bit about smoothing? Could you explain what that is? And if you could talk a little bit about the G6 as well for those who are still using that.
Yeah, sure. So, smoothing in general, the concept is you put some averaging into the readings so that you get a smooth line, right? A smooth graph. And I think, in the past, with some of the previous sensor technologies, some of our, including our very early sensors, we had to do a lot of smoothing because the sensor signals were quite variable. Trying to kind of provide the best performance for a user, we were doing smoothing. With G6, we introduced some smoothing for the trend graph that was slightly different than the real-time displayed value. So you could get real-time display value, which was live and accurate, but then by the time it got to the trend graph, it got smoothed a little bit to give an average. We actually removed that from G6 based on user feedback. So we got a lot of feedback from users that were much more comfortable having just on the trend graph, because you remember you can slide along in and see the values.
Right.
Much more comfortable with those being exactly what the readings would have been and not smooth. So we basically removed it from G6. We've also did not implement it on G7. So we don't have smoothing built into either of those. So the readings are on the trend graph are the readings that were displayed or basically were transmitted every 5 minutes.
Got it. You and I had talked in the past about the silent all alarm.
Yeah.
I may be saying that incorrectly, but that's that alarm, as I'm seeing it, is you get an alert. You say, I know I'm going to be high. I'm eating the ice cream sundae. Tell me later. And you can silence that for a long time. We didn't get that on launch in the US. They have it in Europe. Any update?
It's coming very soon to the US. So we've worked with the FDA to get them comfortable with the feature. We actually had a workshop a week or two ago with the FDA and JDRF and Helmsley talking about the need for the importance of that type of a feature. And so that was a really great discussion amongst Dexcom and other CGM makers, as well as the FDA and Helmsley and JDRF. And so really kind of good acceptance of the need for that type of a control over the alert system, which we knew from the beginning, right? It was a strong user requested feature that we implemented. And it's out in Europe now. People are really enjoying it and using it safely. And so we are bringing that to the US here very shortly. We've actually, one of the things, if G7 users will notice, is we've started doing quite a few updates to the G7 app. So it's kind of playing through what I told you before, which is G7 is going to have a lot more frequent updates than our previous generations based on the way we've designed it. We launched a new version just a couple weeks ago that G7 app that streamlines the account creation process. So that was the point that folks were giving us feedback on, is the email account creation process and stepping through and then jumping in and out of the app to do it. That there was, it took long, it was confusion. So we streamlined that. And so that went out a couple weeks ago, and we've got another release coming out soon that has other enhancements. And Silence All is on the very near-term list. So that'll be coming to the US here quickly. And it's basically within your alert profiles. You can turn it on at any time, or when an alert goes off, you basically can zip into the profiles and say you'd like to silence it. And you get to pick from 10 minutes up to 6 hours. You can basically pick how long you want those things silenced. The most important part about Silence All is it allows you to silence the alarms, and then it automatically will turn them back on after that period of time. You don't have to remember to turn your alerts back on, which is some, people would, if they didn't want their alerts alarming them, they would try to turn them all off, and then you have to remember to turn them back. So it's a significant convenience and discretion factor that we believe is really important for users. And so we're going to get it out here shortly.
If the user uses that, what does it do to the follower? Is it a silent all to the follower?
No, it doesn't change anything. The follower's settings are completely separate from the user, right? When you set up your followers, you can recommend settings for them, but at any time a follower can go in and change their settings. And so it just impacts the local alarms for the user. Followers still get the exact same experience.
Yeah, I heard a lot of teenagers and young adults sigh when you said it didn't affect the follower. They're like, I want to mute my mom for 6 hours.
Yes, there's the
I
whole
understand.
rules of engagement with follow.
And when you said there have been a lot of updates, one came through that it was, I'm going to read it, bug fix to stop notifications from pausing music, CarPlay, and podcast apps. This was another one we had talked about where it kind of breaks through, like, hello, listen to, forget what you're listening to and listen to me. That's gone.
So it basically, there were some issues with the way it was doing that. And so we removed it so that it does. You can still get your alerts when you're listening to music or something. It just does it more seamlessly and more smoothly than it was doing it before.
Great. Because, my listeners listen very carefully. And one of them said, they didn't give you the straight story. They said that was never going to be removed. And then they removed it. But it's still there. It's still there. It's just nicer.
Yeah. It just works more smoothly.
Because I got to tell you, between the not being able to silence all and the breakthrough of the CarPlay, my son turned off a lot of his high alerts.
Yeah.
Probably all of them. I mean, I if I'm being honest, and he's still doing great because those AID systems, man, thank you for doing that when I had a teenager. But I told him about the bug fix and he has now turned it back on.
Cool.
So thank you for that.
Too, there's that new alert in G7 that's the delayed high alert. So you can basically set it so that it doesn't alert you for a period of time when you're over threshold, for the exact purpose of, I know I just ate, I'm not expecting my glucose it'll pass the threshold, but I expect it to come down, and we'll only alert you if it doesn't come down. So that's a G7 feature that we're seeing a lot of people who are using it are getting great outcomes, reduced rebound hypoglycemia, right? So they're not treating on a high that they've already treated. We aren't seeing tremendous number of people utilizing the feature yet because I think it's brand new. So we're trying to bring more awareness that it exists.
One thing we don't talk about enough, when I say we, I mean me, is pregnancy. And, with type 1 diabetes and gestational diabetes. And I know that the G7 is indicated for this. Is it well covered? Do you find that women are able to get covered pretty easily for both, for type 1 pregnancy and gestational diabetes?
Coverage exists. We're still working through that. I think getting the indication was the number one piece to unlock coverage, because everybody wants, gestational diabetes is another important aspect of diabetes, has to be managed. Pregnant women with type 1, they definitely had coverage, right? But the gestational group, there was some coverage out there, some not. But with now removing that contraindication, we now basically have access to that group. And it's basically 1 in 10 pregnancies experience gestational diabetes. And so really feel like CGM is a great tool for them to better manage glucose and see the impact of insulin and not have to do finger sticks, and all that part really simplifies things. And so it is a focus for us to bring more awareness into that segment, and then also ensure that the coverage is there.
That's great. Another question I did get in the group, we have not used G7 longer than, a week or so I can't speak to this. But one of the questions came through, it seems like there is more signal loss with G7, at least for this individual, and a couple of people chimed in that they agree. Is that something that you've seen systemically, more signal loss with G7 than the G6, or is there any advice to curtail that?
Well, I'd say I take that a couple of different ways. We have, people are wearing sensors, in slightly different locations, as a slightly smaller sensor. We are seeing complaints on signal loss, but, we also, with G6, we saw some of that too. We are working on some exciting enhancements to strengthen the Bluetooth performance of G7. While, some customers, there's a lot of kind of feedback on the FAQs around how to improve it. One of the things too is with G7 now, it's a new transmitter every time. So you're doing through the pairing process. One of the things that's in our FAQs is to go in and make sure you clear out all your old your transmitters as you kind of use them. You can go into Bluetooth settings and remove them. That's one of the tips and tricks. The other one is kind of turning Bluetooth on and off, both on the mobile platform side and on the G7 hardware side. We're making some exciting enhancements coming. G7 is brand new for us. We've been learning all about it. And so we definitely when we launched G6, signal loss complaints were up at first because it was a new product for a lot of people. We definitely acknowledged that, hey, we want to keep making that part better. And it's such an important, ensuring reliable communication. So it's a top on our list of things that we're working on to continue to enhance the G7 platform.
Great. The other feature that I think is really interesting is the ability to go to more than one medical device, right? Eventually, G7 will go to 3. And if you're new to this, I guess I should explain it, or let Jake explain it, but you can go to your phone and a medical device right now, i.e. a receiver or an insulin pump.
Soon to be a pump,
Soon to be, and it could be 3. So you'd be able, what's really handy about this, honestly, in our circles is kids at camp. Because right now, a lot of camps do not allow cell phones. So if your child is using the cell phone as their Dexcom receiver, they have to switch over to an actual receiver. And that can be difficult for some people. Anyway, I'll stop explaining it. I'll let you explain it. This is coming, any timeline or anything to add to that?
So it's basically, it's consistent with how G6 works that way too. So G6, it talks to the mobile app and the receiver at the same time, or it talks to the mobile app and a pump at the same time. G7 will do exactly the same. The enhancement with G7 is it can also talk to a third device, which is intended to be a smartwatch. The kind of direct connection to the watch is something that we've implemented in the profile for G7, so in the hardware, and then looking to bring it out as a feature as we update our mobile apps across the different platforms, particularly the iOS platform. So we're continually working on that with Apple. I think we mentioned before the number one thing on direct connect to any device, phone, pump, or watch, is to ensure that you get reliable alerts and alarms, right? That is the most critical, safety critical thing that our device does. And over the years, as we've worked with the Apple Watch platform, ensuring reliable alerts has been one of the biggest challenges because there's so many things that can impact it. And so I feel like we're getting really close. We had some great work with Apple very recently on some watchOS updates to further enable this and ensure that it's reliable. But yeah, that's what's already built into G7, and we just have to get the software and the OS systems compatible.
When you meet with Apple, do you ever ask them like, "Hey, how's it going for your non-invasive glucose monitoring, guys? How's that going?"
They don't, like Apple's. They have a culture of ensuring that things stay very confidential.
Oh yeah.
Actually, none of the public comments about that or the things that we've heard have ever been attributed to to Apple. It's always been, some rumor that somebody says about it. So we don't really know.
Yeah, I agree with you. I hear every podcasting conference I go to, there's a lot of Apple fan guys, and they're always in my face. Like, did you know that they're going to have non-invasive glucose monitoring on the next? And I'm like, okay, that's great. As one of my favorite people says, wake me when it ships.
Yeah. I've been hearing the same thing for 25 years.
Yeah. But to be clear, what I was saying there with I know the G7 was built to have that watch capability, but that third device doesn't have to be a watch eventually, right? It could be just a receiver and a phone and a pump. It
could be. We've got it configured right now to be for a watch.
Oh, okay.
That's the way it's configured right now. But the idea, though, was that we want to be able to communicate to, basically, we want the data where our users find it most convenient. And so the idea was, let's continue to expand the number of devices we can communicate with.
All right. Before I let you go, G8, anything you want to share? Any look down the road? Any fun stuff?
I'd say there's lots of innovation going on here at Dexcom across the sensing platforms, glucose and other things, and as well as the wearable platform and the deployment systems. And we're always innovating, right? We keep that stuff pretty tight to the vest. So not a whole lot to share other than we design our products based on user feedback. And so we take all of that into every generation we build. And so there's some exciting stuff coming with the next generations.
Great. Well, I will say before I let you go, when the G6 came out, which I think was 5 years ago now? Was
2018.
2018. Yeah. So 5 years ago, around this time of year, I cannot tell you what a jump in independence that meant for my son. He was 13. He had never put on a Dexcom by himself. And we have never done a G6. He has done them all by himself. It really represented a leap forward. He started doing infusion sets. He just took off, diagnosed at 2. And we had, I think for little kids, people diagnosed very young, it's hard for them to really get that independence because we're so hovery. Right. They're used to it. It really was a demarcation point that I can look at. And so I'm thrilled that G7 is even easier. And I'm sure, I don't want to do the commercial for you here, but I'm sure there's going to be lots of people, whether they have mobility issues or they're little kids with more independence, that really take this new innovation and move forward. So I don't know, Jake, Thanks so much. I can't believe my kiddo's 18. He's leaving me and going to college. So
Pretty exciting. It's awesome. Yeah, I remember when we first started chatting. So it's been great to see.
Well, thanks so much for all the information. I'm sure we will talk soon.
Cool. Great, Stacy. Wonderful to be here. Thank you.
You're listening to Diabetes Connections with Stacy Sims.
More information about Medicare coverage and the other stuff we talked about, you can just go to diabetes-connections.com, click on the episode homepage. I'll try to link up as much as I can there. There is something I wanted to clarify quickly. I mentioned that I would fact check whether the Dexcom G7 integration with Tandem's Control-IQ and Omnipod 5 system, whether that needed an additional FDA submission. And the answer is no. I was told that an ACE pump, which is what both of those are, with an iCGM, which is what the Dexcom G7 is, needs what's called bench testing. This is a type of testing, I'm reading here, designed to rule out performance-related mechanical or design flaws in the medical device. Performance bench testing of medical devices also evaluates their endurance and capability to perform with the same efficiency under different forms of load. I also went back and looked at the notes from one of Tandem's earnings calls back in February. The CEO specifically talked about the difference between the Mobi device, which is in front of the FDA, and he was saying things like, we don't know the timing because of the FDA, and contrast that with his remarks about integration with Dexcom's G7. He said he thought end of the second quarter, and he did not mention FDA or any other holdup by an outside group. I'm going to link all of this up, and I'll even put some stuff for ACE and iCGM if those are new terms for you. But I thought it was important to come back and clarify something that we left a bit up in the air during the interview. And I admit I did get a little sentimental during that talk with Jake, but the G6 really did represent a big leap forward. I'm going to talk about that in just a minute and what Benny is up to now. But first, Diabetes Connections is brought to you by Dexcom. I'm so excited that Dexcom G7 is here. I know you probably have a lot of questions about insurance. You're not alone. Dexcom understands how complicated this can seem, and they've made it as simple as possible. Dexcom is the #1 covered CGM brand. You can visit the Dexcom Savings Center for a free benefits check to see what coverage options are available to you. Powerful and simple. Dexcom G7 is proven to lower A1C and can help you spend more time in range. Learn more, go to diabetes-connections.com and click on the Dexcom logo. I mentioned during the interview that we started the G6 in April of 2018, and I remember it very well because it was the week that Marvel's Avengers Infinity War was coming out. And we as a family had really gotten into these movies. I'm a big Marvel Comics fan from way back, but my kids had really gotten into it, which was really fun. And we went to see all of the movies leading up to Infinity War. We got to the point where we were going to the Thursday premieres of these movies, where people in my town, I kid you not, where people were dressing up, they were coming in costume. It was a blast. Dexcom had sent us, like they had sent a lot of folks that advertised for them, had sent us a G6 a little bit earlier than the general public, and I wanted him to put it on that day, but we did have our priorities straight, and we went to the movie first. So that's how I remember our start with the G6. But as I said in the interview, and I got really sentimental there, it represented a fundamental change in how my family managed diabetes. Many of you remember the G4 and the G5 and the long inserter, and it was kind of scary. It was very hard to do by yourself. And, as I said, when somebody's diagnosed so young, it's hard both for the parent to stop doing everything, and it's hard for some of the kids to take over their independence. Benny was doing everything for himself away from home at an early age. Probably by age 8 or 9, he was doing everything himself except for that bananas G4 and G5 insertion. But we did everything for him at home. He really leaned on us, which was fine with me because he's got to do this for a long time, maybe the rest of his life. So, why not let us take it and help him as much as we can when he was a kid was our way of thinking, as long as he was independent when he needed to be. So when the G6 came along and he wanted to do it himself, it really represented a brand new stage for him. And now I say it all the time. I only know he's changing stuff when I see it in the garbage. It's sometimes very hard for me to believe when I think back to the little 2-year-old who used to run away from us when we tried to poke his finger or give him a shot. We had long agreed that this year, his senior year of high school, he would be independent with diabetes, and we would just be there as a safety net or for him to lean on when he wanted to, basically a practice year before he went to college. So I have turned off all of my Dexcom alarms except urgent low. And even with Urgent Low, I do not ping him right away. I let him handle that first for a little while. No, this is not easy. Yes, I hate it, but it's been really good for him. Benny also has started ordering his own supplies. I think it's a little early for that, frankly. We're still helping him a little bit, but at least he knows what goes into it. I have a friend who started her kid doing that freshman year of high school, and I know others who don't do it until they get kicked off their parents' healthcare at 26. So, your mileage may vary, but at least he sees what a pain in the butt it is. And he knows where his prescriptions come from in terms of pharmacy or DME or, mail order, that kind of thing. This summer, Benny's going to be a lifeguard at the camp that he's gone to since he was 8 years old, the non-diabetes camp, as I always call it. He's going to be gone for 9 weeks between the staff training and the full session of camp. And then it's off to college. He'll be home for 2 weeks in August, and then boom, he's gone. So yes, I will be using this show as a bit of therapy. You can help me with that. And hopefully he'll come on. He likes to come on and talk to you all about what's going on with him. And if he can find some time before he goes to camp, I'll definitely ask him some questions for you all. That'll be fun. Before I let you go, as I like to say, I'm going to Ireland this week. I will be at the Thrive-A-Betes conference, and I'm leaving, if you're listening as this episode goes live, I'm leaving Thursday of this week, May 4th. It's a very quick trip. I will be back, I don't know if it's Monday overnight to Tuesday or Tuesday early morning. I believe we will have a show next week, but if not, just watch on social media or I'll put something quick in the feed. It might be a day or two late, but I have some great stuff planned for the next couple of weeks. It's just a question of, can I squeeze it in between the travel and a few other things I'm doing for ADA and the Mom's Night Out cities that we just announced. So a lot of balls in the air. I always appreciate your understanding. Thank you to my editor, John Buchanan from Audio Editing Solutions, and thank you so much for listening. I'm Stacey Sims. I'll see you back here soon. Until then, be kind to yourself.
Diabetes Connections is a production of Stacey Sims Media. All rights reserved, all wrongs avenged.